Alright guys, so I just want to discuss with you low back pain and essentially how the disc or the integrity of your disc can be creating your low back pain. So before we go over that, I just want to go over some basic anatomy with you. When you look at a healthy disc, essentially we need to view the disc like a jelly donut. The inside of the disc here, the nucleus, is where all the fluid is, and the outside, imagine that being the jelly of the donut. And the outside here is the bread of the donut. It's that fibrous collagen tissue that keeps the disc fluid within the disc. And that's essentially a healthy disc. However, a lot of times with low back pain, what we see is the integrity of the disc has been damaged. Essentially, the fluid within the disc starts to seep out and starts to crack through all this kind of collagen fibrous tissue. It's been damaged over time. When that happens, the disc fluid then starts to leak into the nerve canal, and you put impingement, stress, tension, irritation essentially onto a nerve, and that's low back pain. How did a disc get like this? Several reasons. One could be a trauma, such as a car accident, repetitive stresses, lifting, for example, working in construction, lots of repetitive stresses. The big one that we see in the office is that corporate lifestyle, lots of sitting. Essentially, when you sit and you have a nice even curve within our spine that's in alignment, the weight of our body is carried in the back of our body, hence why there's all this extra bone and tissues back here. However, when we sit too long, that corporate lifestyle, over time, that spine changes shape. And when it changes shape, you start to put too much stress and tension through the front of the spine. Over time, that's how the disc starts to break down. It's critically important to address disc health, because once we've lost it, it's irreversible. And if you're up for spinal surgery, 72 to 80% of spinal surgeries, you're going to feel the exact same or worse when you come out, and you're 5 times more likely to have one or several more. So it's critically important that we address the disc health. And how do we do that? It's critically through the assessment of the alignment of your spine. We need to make sure you have a 40-degree curve within your spine. We need to make sure all the joints in your spine move within normal range of motion. And we need to make sure the soft tissue, muscle, ligaments and tendons, lengthening their full range of motion, they're stable, and they support us through movement. So if you're suffering with low back pain, in a moment we're going to go over a video of what we use in this office called traction, a non-invasive, non-drug approach to addressing spinal alignment and disc health. Alright guys, so if your spine's out of alignment, the most common form of poor alignment is lack of curve in our spine. When this happens, it puts massive amount of stress and tension into the back of our spine, but specifically and most importantly, it starts to crush the front of our spine here, and that's when we start running into disc issues. We can correct this objectively, and we're going to do that via essentially, first of all, assessing the alignment of your spine, done through some digital x-rays, assessing exactly where your spine has shifted in alignment. And then if you have lost a lot of that curve, we're going to use what we call this target force here. This is non-invasive, it's super comfortable for the patients. Most patients fall asleep, although we told Amber she wasn't allowed to today. So essentially what we're going to do, we're going to contact right in the middle of our lumbar spine with the apparatus here, and then Beamy is going to gently but surely pull onto that blue waist strap there. And what we're going to see is, as she pulls, it's going to induce this curve back into the lumbar spine. And it's all done to patient tolerance. So essentially Amber's nice and comfortable in there. What happens is the ligaments in your spine over time are allowed to heat up, and that allows your spine to stretch back to its normal position. And by stretching it back to its normal position, you shift a lot of the weight from the front of the spine onto the back of the spine where it needs to be, hence all the extra bone back here, and you relieve stress and tension on that disc and also off that nerve. And that essentially eliminates low back pain, but also gives you a long-term objective improvement in your spinal alignment, offering long-term results.